Hi everybody. Section 1.2 here is about observational studies versus designed experiments. Um, so what we want to do in this section is talk about being able to distinguish between an observational study versus an experiment and explaining the various types of observational studies. So let's look at objective one, distinguishing between an observational study and an experiment. So let's look at an example here. So researchers Joachim Schutz and associates wanted to investigate cancer risk among Danish cell phone users who were followed for up to 21 years. So to do so, they kept track of 420,095 people whose first cellular telephone subscription was between 1982 and 1995. And in 2002, they recorded the number of people out of the 420,095 people who had a brain tumor and compared the rate of brain tumors in this group to the rate of brain tumors in the general population. So in this case, right, this would be an observational study. So they found no significant difference in the rate of brain tumors between the two groups, and so the researchers concluded that cell phones use was not associated with increased risk for brain tumors. So this would be an example of an observational study because you're not controlling for any of the variables. Here's another example. Now this would be an example of an experiment. So researcher Joseph Roddy and associates examined whether chronic exposure to radio frequency radiation at two common cell phone signals, a frequency of 835.62 megahertz and a frequency used by analog phones of 847.74 megahertz, which is a frequency used by digital cell phones. Then they tested this on rats, and so the rats in group 1 were exposed to the analog cell phone frequency, and the rats in group 2 were exposed to the digital frequency, and the rats in group 3 served as controls and received no radiation. So since we are controlling for a variable here, this would be an example of an experiment, not an observation. And the experiment was done for 4 hours a day, 5 days a week for 2 years, and the rats in all three groups were treated the same except for the RF exposure, or as much as they could be. After 505 days of exposure, the researcher reported the following. After analyzing the data, we found no statistically significant increases in any tumor type, including brain, liver, and lung or kidney, compared to the control group. So this would be an example of an experiment. So again, to distinguish between a observation and experiment, right? In both studies, the goal of the researchers was to determine if radio frequencies increased the risk of contracting brain tumors, and whether no brain cancer was contracted is the response variable, and the level of cell phone use in this case is the explanatory variable. So in research, we wish to determine how varying amounts of the explanatory variable affects the value of the response variable. So in other words, you can sort of think of the explanatory variable as the cause and the response variable as the sort of the effect, although there's technically no, you can't necessarily make a causal connection between the two. You can kind of think of it that way. So again, to distinguish between an observational study and an experiment, right, so an observational study measures the value of a response variable without attempting to influence the value of other response variables. In other words, trying to control, it doesn't try to control to make sure that the one variable that you're trying to measure is the only thing that's causing the influence, whereas in an experiment, you're intentionally changing the value of explanatory variables and then trying to control for all other variables. So let's look at an example here. And we'll see if we can determine if this is a designed experiment or an observational study. So some researchers in this case wanted to determine the long-term benefits of the influenza vaccine on seniors age 65 and older. The researchers looked at a record of over 36,000 seniors for 10 years. The seniors were divided into two groups. Group 1 were seniors who chose to get a flu vaccination shot, and Group 2 were seniors who chose not to get a flu vaccination shot. And after observing the seniors for 10 years, it was determined that seniors who get flu shots are 27% less likely to be hospitalized for pneumonia or influenza, and 48% less likely to die from pneumonia or influenza. So again, in this case, is this an observational study, or would this be a controlled experiment? Right? In this case, right, this would be an experiment, right, because you're controlling for one of the variables. So based on the results of this study, there are a couple things we can talk about here. Some terms here. Would you recommend that all seniors get the flu shot? Well, maybe, but there could be some confounding in variables here. Maybe, maybe the reason why the seniors who got the vaccination shot had less hospitalization and things like that is maybe they were the ones that were, maybe they were visited by doctors or nurses more often, and so maybe they caught other diseases or something, or they got more care, and it had nothing to do with whether they got the flu shot or not. Maybe it just had to do with the fact that they were getting more medical attention in general. So that can happen. Confounding in a study occurs when the effects of two or more explanatory variables are not separated. Therefore, any relation that exists between explanatory variable and response variable may be due to some other variable or variables not accounted for in the study. And a sort of a hidden or third variable is what's known as a lurking variable. Like I said, you can sort of think of the flu shot as the explanatory variable, and the response variable in this case, whether the senior was hospitalized or not. Again, that doesn't necessarily imply cause and effect between the explanatory and response variable. Some other variables that might influence the the age and health. Maybe if the seniors had to go somewhere to get the flu shot, those who were healthy or had more mobility would be the ones that were included in the study. So again, you can't necessarily establish cause and effect. So even after accounting for potential lurking variables, the authors of the study concluded that getting the influenza shot is associated with a lower risk of being hospitalized or dying from influenza. Again, that doesn't mean that that's the cause, though. And so, again, observational studies do not allow research to claim causation, only association. So yeah, I'm sorry, I guess this would be an example of an observational study, not an experiment, because they're not really controlling for any of the other variables. So let's look at some other types of observational studies. So you can have a cross-sectional study. So these are studies that observe, they're studies that collect information about an individuals at a specific point in time over a very short period of time. So you look at a bunch of individuals over a short period, maybe a day or two. So it's like you're taking a slice or a cross-section. You can talk about case control studies. These studies are retrospective, right, meaning that you might look back at data or records. And then there's also cohort studies, which is basically you identify a group of people and then you sort of follow them over a long period of time as opposed to a cross-sectional study. And since data is collected over time, these are sometimes called prospective studies. So let's look at some examples here and see if we can identify what's being done here. So let's say you want to determine whether the following studies depict an observational study or an experiment. If the researchers conduct an observational study, determine the type of observational study. So in this case, researchers wanted to determine the long-term psychological effects of children evacuated during World War II. They obtained a sample of 169 former evacuees and a control group of 43 people who were children during the war but were not evacuated. The subjects' mental states were evaluated using questionnaires. It was determined that the psychological well-being of the individuals was adversely affected by evacuation. So the question is this an observational study? Is it an experiment? And again, what sort of experiment would this be? So this would be an observational study, and it would be case control, right, because you're looking backward in time. You're not following a group of people over time. Another example would be that there's a drug called xylitol that's been effective in preventing cavities when included in food or gum, and a total of 75 Peruvian children were given milk both with and without xylitol and were asked to evaluate the taste of each. Overall, the children preferred the milk flavored with xylitol. So again, is this a designed experiment or an observational study? So this would be a designed experiment, right? The response variable would be whether the children like the flavor or not. The explanatory variable would be whether the milk contains xylitol or not. And again, because this is an experiment, we don't need to determine what type of observational study it is. Here's another example. So let's say a total of 974 homeless women in LA were surveyed to determine their level of satisfaction with the health care provided at shelter clinics versus the health care provided by government clinics. And the women reported greater quality satisfaction with the shelter and outreach compared to the government clinics. So this would be an observational study, and again, this would be cross-sectional because you're following, this is over a short period of time. Another example would be the Sp15 study, which was a cancer prevention study. And this was conducted by the American Cancer Society. So the goal of this study in this case was to examine the relationship between environmental and lifestyle factors in cancer cases. And in this case, they tracked about 1.2 million men and women. And study participants did a questionnaire in 1982, and they provided information on a range of lifestyle factors, such as their diet, how much alcohol and tobacco they used, what their occupation was, medical history, and family cancer history, and things like that. And these data were extensively examined, and the vital studies of the participants is updated biennially. And then the cause of death has been documented for over 98% of all deaths that have occurred. So in this case, again, what is this? Well, this would be an observational study, and this would be a cohort study because you followed them over a long period of time. And you might wonder why you would maybe want to conduct an observational study versus an experiment. If an experiment is sort of better because you can control for things. Well, again, experiments can be expensive. And so maybe doing an observational study is less expensive. It might also be that an observational study is more ethical if you're trying to do an experiment on, the cause of, radiation on people. You wouldn't want to irradiate a bunch of people and then see what happens, right? You'd probably want to look at something where that had already happened. So the last thing we want to talk about here in this section is a census, and this is a list of individuals in a population along with certain characteristics of each individual, right? I think we all know sort of what a census is. So I guess the main thing that I might ask you in this section is to give you some examples of some experiments and have you identify whether they're an observational study or an experiment, and if it is an observational study, what kind of observational study it is. So hope that helps. If you guys have questions about anything else or whatever, let me know. The next section we'll look at, which is section 1.3, is about simple random sampling. So in other words, how do you collect, the data that you might be using in your experiment in a unbiased way.